So myofunctional therapy is kind of a specialized therapy where we are looking at how the tongue and the mouth work together. So when we look at a lot of growth, if you look at a patient and you look at their space. So when we look at someone who's breathing, swallowing, their posture, a lot of it comes from how their tongue sits and how strong the muscles are to be able to hold that tongue and the rest of the facial muscles where they should. So our 4 goals of therapy with myofunctional therapy are proper tongue posture. Again, sitting in the roof of the mouth, because that tongue posture will naturally act as an expander to help shape where we want those teeth to come in. If your tongue's not sitting up where it should, you get this really narrow mouth, which also then leads to a narrow nose, which then is harder to breathe. So we kind of talk about the cycle of it, and it continues to get worse as these things continue and you don't correct them. Another goal of myofunctional therapy is to correct swallowing pattern. Again, some kids with this, honestly, adults too, if we don't have the right oral posture, we are not swallowing correctly. And a lot of people don't understand that there is an incorrect and a correct way. And if you don't have the correct function of the tongue, is going to be inhibited. We're also focusing on nasal breathing. A lot of what I talk to parents about for themselves and for kids is nasal breathing and how important it is to be breathing through our nose and not our mouth. There's a lot of research about mouth breathing and how detrimental it can be, but also how well we do when we're nasal breathing. And then also lip seal. So that goes back to, if our lips can be closed, if we can close them together, we will breathe better, we'll function better, our tongue will be sitting up where it should. So it's different than speech therapy, and that speech, we're looking at specific sounds and how to use the tongue to make those sounds, where myofunctional therapy is really working with all the facial muscles, including the tongue, to help us breathe and function and swallow the best.